Over the past few days, we've been listening to the healthcare horror stories from across the country, such as families earning an annual income of $50,000 who opted for high-deductible coverage and are facing up to $6,000, or in one case, $10,000 of out-of-pocket costs before their coverage even begins. That is not affordable insurance. Nearly 7 years after the enactment of Obamacare and 3 years into implementation, one thing is crystal clear: Obamacare has failed. But Republicans are working to fix the damage. Over the past several years, it's clear that this law is simply unworkable for millions of hardworking Americans. Insurance markets are collapsing, premiums are soaring, and healthcare choices are disappearing. But the answer isn't to ignore the problem. With Obamacare getting worse by the day, it is time for us to act. The repeal resolution we're debating this week promises relief from Obamacare and provides the tools necessary to immediately repeal this failed law while ensuring a stable transition period to a patient-centered healthcare system that gives Americans access to quality, affordable care. The resolution includes instructions to authorizing committees so that repeal legislation can move through a fast-track process and can pass with a simple majority in the House and Senate. These instructions to committees are provided to allow immediate action on repeal with the intent of sending legislation to the new president's desk as soon as possible. Headlines from across the nation highlight the urgent call to action. The New York Times says, Obamacare premiums set to rise even for savvy shoppers. The Wall Street Journal says, insurers move to limit options in health care exchange plans. The Baltimore Sun says, Marylanders face hefty rate increases for Obamacare. The Omaha World Herald, health insurance rate increases may have some Nebraskans in sticker shock. Miami Herald, Florida's Obamacare premiums to rise an average of 19% in 2017, the state says. And the Bergen County Record, New Jersey left with just 2 Obamacare health providers for 2017. My own state of Wyoming is down to 1 insurer in the individual market, both on and off the exchange. That's a national scandal. We've heard from people who've talked about counties where there are no insurers. We've heard of people talk about the costs that they have both for the premiums and the deductibles. And just talking about the premiums, in New Mexico, they had some counties where the average cost of a house payment is less than the monthly cost of their health care, much less, about 50% less in one instance. Now, it's also important to look at the facts surrounding Obamacare. Some on the other side of the aisle like to focus on how many people are insured under the law. But let's look at how many are not insured. Almost 28 million Americans remain without insurance under Obamacare. Even with insurance, many still can't afford the care due to surging deductibles. If you can't afford the deductible, you really don't have insurance. If you can't afford the insurance, you don't have insurance. And it isn't the insurance that's important, it's the availability of providers that can take care of you. And most of the newly insured only gain coverage through a flawed Medicaid program that's providing inferior quality and threatening to bankrupt states across the nation. Now, according to research from the architect of Obamacare, which is Jonathan Gruber, he explicitly said most of the newly enrolled beneficiaries were actually eligible for Medicaid before Obamacare. In fact, his research showed that 2/3 of new people signing up for Medicaid were brought into the program not through Obamacare, but by increased Medicaid advertising. Now, as America soon discovered, the president and congressional Democrats focused exclusively on coverage. And mandates were handed down from Washington instead of patient-centered reforms. Coverage was the silver bullet for them because coverage equaled health care. They forgot a key detail, though. The cost of the plans they were mandating made it nearly impossible for many to pay for the insurance, or if they had coverage, to pay for care with the sky-high deductibles. I know that some people on my staff had health savings accounts, which gave them catastrophic coverage. They didn't have to worry about going bankrupt over a health care thing. Their deductibles were lower than the ones that we have with this health care. Focusing on and highlighting the number of people now enrolled in Obamacare doesn't translate into anything more than phantom insurance, which users plagued by inadequate coverage are coupled with huge out-of-pocket costs. We're seeing families now having to forego medical care, not because they don't have insurance, but because it's simply too expensive to go to the doctor with their Obamacare health plan. Normally, I'd say, you get what you pay for. But with Obamacare, you seem to just pay without getting much at all. It's kind of like buying a bus ticket, but when you show up for the trip, they tell you that to get a seat, you're going to have to spend a little bit more, and then you're going to have to chip in for the gas. For years, Republicans have pledged to repeal this disastrous law. Passing this resolution is just the first step in keeping that promise, clearing the way for consideration of repeal legislation that will be signed into law by the new president. While providing immediate relief from Obamacare, Republicans will ensure there is a stable transition in which those with insurance will not lose access to health care coverage. This will allow the nation to move to a patient-centered health care system that gives hardworking Americans access to quality, affordable care. The goal is a more modern health care system where there is innovation to improve the health of all Americans, where insurers are offered new and affordable options, and where families have more direct say over their own health care decisions. Unwinding partisan gridlock to make these changes will not be easy. As I noted in my earlier remarks, our nation has made great strides in improving the quality of life for all Americans. But these transformative changes are always forged in the spirit of bipartisan compromise and cooperation. We still need health care reform, but it has to be done the right way. Passing this resolution will start building a bridge from Obamacare's broken promises to better care for each and every American. Thank you, Mr. President. I yield the floor. And suggest the absence of a quorum.
The clerk